You're big on IV sedation.
Absolutely. For me, it's the only way to practice. When we're doing these bigger, complex treatments, as it is, nobody likes coming to the dentist. I mean, I hear it all the time.
Do they say to you, like, no offense, doc?
Every day.
Do you have a funny one-liner after all these years?
Well, I tell them, you're not going to hurt my feelings. I don't want to be here either. But, we're
Okay,
here,
good.
and, let's do the best we can to get you taken care of. So with IV sedation, we're able to get patients the treatment that they need and do it in a way where they're comfortable. They don't remember the procedure. They go to sleep, and
they remember very little of the procedure.
They remember very little, and time just seems to go by. So even if it's a 3 or 4 hour procedure, for them it might be like 30 minutes, and it really allows them to come in and get the treatment that they need, but in a comfortable fashion to where they can get through it, we can get through it, and everyone's happy.
Now, what about safety? Like, how does it stack up?
So
with sedation, we're talking about.
Well, depending on the case, sometimes we do general anesthesia and sometimes we do moderate sedation. But in all cases, our patients are safer because we're able to manage, through anesthesia and IV, their health. We're monitoring them, and so they never get to the point.
Blood pressure?
Blood pressure, oxygen levels. They're getting supplemental oxygen. And the medications that we give them actually can help lower their blood pressure or keep them at a state where they're just comfortable. They're not stressing their body like they would otherwise because they're not tensed up.
When you say you could do like 6 months worth of dental visits in one visit, what does that mean? Because of sedation.
So a lot of times, we're limited based on what the patient can tolerate. And so, they can only be in the chair for so long and they can only take so much treatment. So in cases like that, we have to appoint them multiple times to come back just to finish something. With IV sedation, we can do more in a single visit because we've taken that aspect out of it. The patient's not stressed, they're not tense, they're not sitting there in the chair worried about how much longer am I going to be here, and so we can finish treatment faster. So as an example, in some cases I can do implants and crowns, something that may take 4 to 5 hours because we're working on both sides of the mouth and multiple areas, and that patient without sedation would probably have to come a few visits. But with sedation, we can get everything taken care of in one visit, and then they're out the door in a few hours, but they don't have to come back for it. So with sedation, because we can reduce the number of visits, I mean, I've got kids, taking time off work is difficult to have to go back multiple times. And
you have 3 kids?
I've got 3 kids.
3 little dentists?
Yeah, hopefully.
I'm joking.
But, or to have to get permission from your boss to go to the dentist 5 or 6 times to get one tooth taken care of, so it's tough. And again, with IV sedation, we can just do more in one visit. Patients happier, less stressful, and they can get the work that they need in and out and be done in 1 to 2 visits.
What about the phobics? Like, people are just literally afraid of the dentist.
Yeah, and those are the ones that...
Is that rare?
It's common.
Really?
And we see it often. And in our office, because we can do sedation and we can do these more complex treatments, then that's when we see those patients that haven't been to the dentist in 20 to 30 years because they're scared. But knowing that they have an option where they can not only get the treatment that they need, but in a fashion that they don't have to stress and worry about, they can finally get the treatment that they've been putting off for years.
Is it true that like less than 10% of all general dentists even have IV sedation available? I mean, as far as that training?
It really is,
Is
it's
it
a
even
shame.
more than that, less than that?
It's probably more than that. And it's a shame because with that type of sedation, that service that we can offer our patients, it's really what helps, keep them coming and keep them coming in the door instead of shying away from us. Nobody likes going to the dentist because it's painful,
Right.
It takes forever, and it's stressful. I mean,
you said for some people you have to give them a pill the night before. They're so nervous about the dentist.
Yeah, absolutely, because without a good night's sleep, then they come in and their blood pressure's through the roof, and they're anxious and they're stressed out, and so, with the pre-sedation and then the sedation visit, we take all that out the door.